What we know very clearly about low back pain is it's very common and it's very costly in our westernised societies. Nearly all of us will get low back pain at some point in our lives. Around 80%, I think, is the estimate.
The traditional diagnostic approach to trying to differentiate patients, to decide which patients can we give confidence to self-manage and which patients do we need to give that extra little bit of help to, hasn't really been working. It's not been systematic enough in helping us to identify the patients that end up with all serious problems and those that get better themselves.
So the challenge is that we don't know which patients to offer which treatments to.
And what's done at the moment in primary care practice is it's left to clinical intuition to decide, OK, which patients do we give that extra help to and which patients can self-manage. And so I guess what we're trying to do with the research that we're doing here is saying, can we be a bit more systematic about trying to work out which patient goes where, and can we be more efficient so that we're not missing the people that really are going to end up with serious problems, and we're not over-treating people who are going to get better anyway.
So again, what we're trying to identify are better ways to match the right patients to the right treatments.
The way that we're using our new approach, the new Start Back approach, is that when a patient comes to see their doctor or a physiotherapist with an episode of back pain, we ask them to fill in this short questionnaire. And that then helps the physiotherapist or the doctor decide which type of treatment might be most appropriate for that patient.
It's a very simple tool. It just has 9 questions. For each of the questions, the person just agrees or disagrees, and you're able to simply calculate from that the risk category that someone would be allocated to, and that then will inform decision making.
It's very much a patient self-complete 9-item tool. It's very quick for the patient to fill in, very easy. And what we found was the patient would come for their first appointment, physiotherapy appointment, and as they were sitting in the waiting room, they could fill it in very quickly. And then bringing the patient in for their first assessment, we could again very quickly score the tool. And then that tool actually allowed us to guide our assessment and treatment with the patient. And so it's very quick and easy to use.
I thought it was a fairly easy, straightforward questionnaire, really. A typical questionnaire with agree and disagree boxes. So basically I just worked my way through the questions, agreeing or disagreeing with what it said.
Because we believe that this new approach has really important implications for people who are delivering services for people with back pain and people who are commissioning services for people with back pain.